Stomach pain after the age of 60 can have various causes and should not be ignored, especially if it's persistent or severe. Here's a brief overview. Common causes of stomach pain after 60. 1. Gastroesophageal reflux disease (GERD), acid reflux or heartburn may become more frequent with age. 2. Peptic ulcers, often caused by H. pylori infection, or long-term NSAID use. 3. Diverticulitis, inflammation or infection of pouches in the colon, common in older adults. 4. Gallstones, more common with age, and can cause upper right abdominal pain. 5. Pancreatitis, inflammation of the pancreas, often due to gallstones or alcohol use. 6. Constipation, common with age due to diet, medications, or reduced activity. 7. Colorectal cancer, risk increases with age, pain may be accompanied by weight loss or changes in bowel habits. 8. Medication side effects, certain drugs e.g., NSAIDs, antibiotics, statins can irritate the stomach lining. When to seek medical attention. Pain is severe, persistent, or worsening, accompanied by weight loss, vomiting, or blood in stool, fever or signs of infection, change in bowel habits. After age 60, some seemingly normal or mild stomach-related symptoms can actually indicate more serious, underlying conditions. Here are 7 symptoms that may appear harmless, but should not be ignored. Number 1. Persistent bloating. Could indicate ovarian cancer, pancreatic issues, or gastrointestinal obstruction. If bloating lasts more than a week or worsens over time, it needs evaluation. Number 2. Frequent heartburn or acid reflux. Could indicate GERD, Barrett's esophagus, or even esophageal cancer. Chronic heartburn isn't just a discomfort, long-term acid exposure can damage the esophagus. Number 3. Unexplained weight loss. Could indicate stomach cancer, pancreatic cancer, or malabsorption syndromes. Losing weight without trying, especially with appetite loss, is a red flag. Before we begin, if you have not subscribed yet, I recommend you subscribe and turn on the bell so you do not miss any videos. If you enjoy this video, please type like in the comments. If you do not like it, type unlike in the comments to let me know so. Number 4. Early satiety, feeling full quickly. Could indicate peptic ulcers, gastric cancer, or motility disorders. Feeling full after a small amount of food regularly may point to a stomach or GI issue. Number 5. Nausea and vomiting. Could indicate intestinal obstruction, stomach ulcers, or even a heart attack, especially in women. Ongoing nausea, especially with vomiting, should always be evaluated. Number 6. Change in bowel habits. Could indicate colorectal cancer or diverticulitis. New constipation, diarrhea, or a change in stool appearance, e.g. narrow, pencil-like, is concerning. Number 7. Abdominal pain that comes and goes. Could indicate gallbladder disease, pancreatitis, or gastrointestinal tumors. Recurrent pain, especially if worsening or paired with other symptoms, warrants investigation. Note, as we age, pain perception can change and chronic conditions can mask new symptoms. It's essential to consult a healthcare provider for any persistent or unusual digestive symptoms. Stomach pain in individuals over 60 can result from a wide range of causes, some mild and others more serious. Here are common reasons, categorized for clarity. Common and less serious causes. 1. Indigestion or gas, often caused by dietary choices or slowed digestion. 2. Constipation, common with age due to decreased mobility, low fiber, or medications. 3. Gastritis, inflammation of the stomach lining, often due to NSAIDs or alcohol. 4. Acid reflux, GERD, heartburn and upper stomach pain from stomach acid backing up. 5. Food intolerances, lactose intolerance or others may develop or worsen with age. Age-related or more serious causes. 1. Gallstones can cause shock pain in the upper right abdomen. 2. Diverticulitis, inflamed pouches in the colon, common in older adults. 3. Peptic ulcers, sores in the stomach lining, often due to NSAIDs or H. pylori. 4. Pancreatitis, inflammation of the pancreas, often with upper abdominal pain. 5. Hernia, especially inguinal or hiatal hernias, causing pain or discomfort. Critical or emergency causes. 1. Abdominal aortic aneurysm (AIA) can cause sudden, severe pain and is life-threatening. 2. Bowel obstruction, severe pain, bloating, and vomiting may require surgery. 3. Colon cancer, especially if pain is persistent, with weight loss, or changes in bowel habits. 4. Ischemic bowel disease, reduced blood flow to intestines, causing pain after eating. Other considerations. Medication side effects. Many older adults take multiple medications, which can irritate the GI tract. Urinary issues, sometimes mistaken for stomach pain, e.g., UTI or kidney stones. If stomach pain is sudden, severe, persistent, or accompanied by fever, weight loss, vomiting, or blood in stool, it's important to seek medical attention promptly. Stomach pain after age 60 can be due to many causes, and it's important not to ignore it, as it could signal a more serious underlying issue. Here are some common causes, and their potential health effects. Common reasons for stomach pain after 60. 1. Gastrointestinal disorders. Gastritis or ulcers, inflammation or sores in the stomach lining. Diverticulitis, inflammation of small pouches in the colon. Gallstones can block bile flow, causing pain and digestion issues. Irritable bowel syndrome, IBS, causes cramping, bloating, and changes in bowel habits. Inflammatory bowel disease, IBS, like Crohn's or ulcerative colitis. 2. Medication side effects. NSAIDs like ibuprofen can irritate the stomach lining. Blood thinners and certain antibiotics can cause abdominal discomfort. 3. Reduced digestive efficiency. Aging can slow digestion, leading to bloating, gas, or constipation. 4. Cancer. Stomach or colon cancer risk increases with age. Persistent or worsening stomach pain may warrant screening, e.g., colonoscopy. 5. Hernias. More common in older adults and can cause localized pain or pressure. 6. Pancreatitis or liver disease. Can cause upper abdominal pain and may be related to alcohol use, gallstones, or infections. 7. Constipation. Often worsens with age due to diet, hydration, or decreased activity. When it's concerning. Persistent or severe pain. Unintended weight loss. Blood in stool or vomit. Ongoing nausea or vomiting. Difficulty swallowing. Pain that wakes you at night. Next steps. See a doctor if any red flag symptoms are present. Lifestyle changes like eating smaller meals, avoiding trigger foods, staying hydrated, and exercising may help. Regular screenings, e.g., for colon cancer, are important after 60. Managing stomach pain at home after age 60 requires care, as older adults are more prone to complications. Here are safe and effective steps you can take, but consult a doctor if the pain is persistent, severe, or new. 1. Identify the cause if possible. Common causes include gas or indigestion, constipation, acid reflux or GERD, ulcers or gastritis, medication side effects like NSAIDs, gallbladder or pancreatic issues. 2. Home remedies. Warm compress. Apply a heating pad or warm cloth to the abdomen to relax muscles and reduce cramping. Ginger or chamomile tea, both can help soothe the stomach and reduce inflammation. Eat light and bland foods. Try boiled rice, bananas, toast, applesauce brat diet, or oatmeal. Stay hydrated. Drink water throughout the day, especially if there's diarrhea or vomiting. Avoid triggers. Skip spicy, acidic, or fatty foods and caffeine. 3. Over-the-counter medications if approved by your doctor. Antacids e.g. Tums, Maalox, for acid-related pain. Simethicone e.g. gas, for gas pain. Pepcid or Zantac, for longer-term acid control. Mild laxatives, if constipation is a factor. 4. Lifestyle adjustments. Eat small, frequent meals. Don't lie down immediately after eating. Raise the head of the bed slightly if acid reflux is a concern. Track food and symptoms in a journal. 5. When to see a doctor. Seek immediate medical care if you experience severe or persistent pain. Pain with fever, vomiting, or blood in stool. Sudden weight loss. Difficulty swallowing. Pain spreading to chest, back, or shoulder. Managing stomach pain at home after age 60 with food can be effective if the cause is mild like gas, indigestion, or acid reflux. However, persistent or severe pain should be checked by a doctor. Here are foods and tips to help soothe the stomach naturally. 1. Gentle, soothing foods. These help calm the stomach lining and reduce inflammation. Bananas, easy to digest, helps neutralize stomach acid. Oatmeal, bland and soothing, great source of fiber. Rice or plain toast brat diet, gentle on digestion. Boiled potatoes or carrots, easy to digest and nutritious. Applesauce, mild and rich in pectin, which may ease digestion. 2. Anti-inflammatory foods. To reduce irritation in the stomach. Ginger tea or fresh, helps with nausea and digestion. Chamomile tea, soothes the digestive tract. Aloe vera juice unsweetened, may help reduce acid and soothe irritation. Turmeric in small amounts, anti-inflammatory, can be added to warm milk. 3. Foods that fight acidity or gas. Yogurt with probiotics, supports healthy gut flora. Papaya, contains enzymes that help digestion. Fennel seeds chewed or made into tea, reduces gas and bloating. Mint tea or leaves, eases indigestion and cramps. 4. Hydration. Warm water, gentle on the stomach and helps digestion. Coconut water, soothing and replenishes electrolytes. 5. Foods to avoid. To prevent worsening pain. Spicy, greasy, or fried foods. Citrus fruits if acid reflux is the problem. Coffee, alcohol, and carbonated drinks. Onions, garlic, or heavily seasoned foods. Dairy if lactose intolerant. When to see a doctor. Pain lasts more than a few days. There's blood in stool or vomit. Unexplained weight loss. Pain is severe or sudden. Would you like help identifying foods based on a specific type of stomach issue, e.g., ulcers, gas, reflux? Narrowing down the possible cause based on your symptoms. I can help you go through your symptoms more specifically to narrow things down. And assessing symptoms or knowing what tests might be recommended. Like a printable checklist or infographic for these, a more detailed explanation of any of these causes or how